Hi, I'm Dr Sylvestre with Focus and Flourish. Time to talk about tension relieving techniques that are proposed when there's a lot of tension on a wound to be closed. The mattress suture is one that is commonly described for skin edges with tension on them. Horizontal mattress, which is the box-like pattern, is the one that is most commonly used. And if there's going to be a fair bit of tension, some textbooks will describe that you should use some sort of maybe IV tubing or buttons or something to help and disperse some of the tension that your suture material is going to apply to the skin edges, which are already under tension. That's why you're using a tension suture pattern. The vertical mattress, it tends to be a little kinder to the blood supply. Keep that in mind. Although it doesn't necessarily make your skin edges sit very well. So the vertical mattress, although better for the blood supply, is not used as commonly. The walking sutures. Definitely, this has been one of my favorites because you undermine a little bit and then you go grab the skin way down in there and then you tack it down someplace a little closer to where the edge of your incision is going to be. So it kind of walks it walks the tension away from your incision or your suture line itself. The release incisions. These are the idea of the release incision is your skin is under tension, and so you're going to make small little nicks where the tension's at the highest, kind of randomly. Don't clearly put them in a line, randomly. And this will help to relieve the tension at the main incision itself, and you let those small little incisions heal by second intention, which they will. This technique is really meant to be for the limbs. Honestly, the place to use it is if you put a plate on a fractured bone and you want to be able to cover the place. So now there's a lot of swelling in the tissues and you have a hard time closing your primary skin incision that you made to go in and put the plate on. This is where the release incisions come in and they work very well. I do not recommend that release incisions be used anywhere else on the body. Let's take a closer look at what happens to the vasculature when we apply some of these tension relieving techniques. So you have a large wound that you're wanting to close. And in order to close it, you're going to undermine and move those skin edges closer to one another. So you're going to pull a bit on that subcutaneous tissue and skin. When you're doing that, you're also going to be stretching the vasculature in the area with the skin and subcu that you're pulling. When a blood vessel gets stretched, it narrows, it thins. It's a tube and it's elastic, right? So it's going to thin. As it thins out, it's going to bring less blood to the area. And now you are going to add a tension relieving suture. So a horizontal mattress. You've got blood vessels that have thinned out because they're a little bit under tension. And then you add more tension with your mattress suture on top of it. Even if you put IV tubing there, you're still adding more tension. And what we don't know is that the piece that is going to cause that diminished blood supply to the area to be significantly diminished to the point of causing necrosis. The same concept applies to walking sutures and release incisions. The potential for snagging or stretching a blood vessel with your suture or simply cutting it with a release incision is high. That's something for you to be aware of. Personally, I have stopped using walking sutures, mattress sutures. I simply undermine more. Undermine more, worry less. You'll have much greater success. I hope you found this video helpful. Please hit the like button and subscribe to our channel.